Recording in progress.
So, aphorism number 91, where Dr. Hahnemann mentioned that if the patients come from other doctors. So, in aphorism number 91, the symptoms and the feeling of the patients during a previous course of medicine do not furnish the pure picture of the disease. Patients already taking homeopathic medicines, these are unknown to us, or many times the other homeopaths will not give all the informations of the medicines. I have that recently case from Sweden, and where the patients already taking medicine from last 3 or 4 years, and after taking lots of medicine from other doctors, now she is starting taking medicine by herself. Whatever she feel this is good for me or that is good for me, she already taken. So after this, she doesn't have any effects, no results, nothing there. So in this situation, we can do antidote, and mostly I recommend to take coffee for 3 days. A cup of coffee, it will maximum times, it will give you a clarity or purity of the symptoms. So the symptoms and the feeling of the patients during a previous course of medicine do not furnish the pure picture of the disease. If somebody taking already medicine, taking lots of medicines, it will not give you a pure picture. It will not provide us a pure picture of the case. So what we can do? But on the other hand, those symptoms and ailment which he suffered from before the use of medicines, or after they had been discontinued for several days, give the pure fundamental idea of the original form of the disease, and these especially the physician must take note of. The patient is already taking medicines, you cannot get the pure picture, and during this period, if we have information what types of symptoms before taking the medicines, this is one criteria. And other thing, we have to leave the patient for several days so the effects of that recently taking medicines goes down and we can get the pure picture. So we have to apply this trick or this advice of Hahnemann in every case whenever the case is coming from other homeopaths. It will give us more clarity. So when the disease is of a chronic character and the patient has been taking medicine up to the time he is seen, the physician may be advantage leave him some days quite without medicines, or in the meantime administer something of an unmedicinal nature and defer to a subsequent period for more precise scrutiny of the morbid symptoms in order to be able to grasp in their purity and the permanent uncontaminated symptoms of the old affections and to form a faithful picture of the disease. So here, this is a good advice because we already discussed about if the patient is coming from allopathic hand. And the aphorism number, anyone? If the patient is coming from allopathic hand, any guess? So this is the aphorism number 207. If the patient is coming from allopathic hand, if the patient, he or she didn't take yet homeopathy, but he already taking allopathic medicines, we have to note that down, 207. And if the patient is coming from homeopathic hand, then we have to go through aphorism number 91. But here is the condition where the patient having time, patient suffering from chronic disease, he already taking lots of homeopathic remedies. We have to leave the patient, but sometimes the symptoms are very quick and the patient need a medicines. So we have to go through aphorism number 92. 92, where Dr. Hahnemann says, if the disease, if be a disease of a rapid course, and if its serious character admit of no delay. So you have a situation where you have to prescribe the medicine as soon as possible. Then the physician must content himself with observing the morbid conditions. Then we have to observe the patient. We have to uh, judge the whole symptoms and alter though it may be by medicines or observing the morbid conditions. So we have to observe. It may be because of the medicines. And if he cannot ascertain what symptoms were present before the employment of the medicine, he already, sometimes the patient has no idea what kind of symptom before the medicine, and because he already mentioned that after taking this medicine, I have these symptoms. And many times, especially when the person is taking allopathic medicine or the overreaction of the patients, and I have seen one person who take the COVID vaccine, and after COVID vaccine, the whole body become reddish, like a bright reddish color, and very excessive heating and itching. And in this situation, we have to judge immediately and prescribe the remedy. If he cannot ascertain what symptoms were present before the employment of medicine, in order that he may at least form a just apprehensions of the complete picture of the disease in its actual conditions. And that is the of the conjoined malady found by medicinal and the original disease, which form the use of inappropriate drug in general more serious and dangerous than was the original disease. So he will mention that I have that disease and I have taken medicines, but in that situation, when the person is already suffering, he will not able to explain what kind of symptoms before that medicines. And this is the situation where original disease and the medicine disease join together and make one different kind of symptoms, different kind of situations. So hence demand prompt and efficient aid. So we need to prescribe the remedy. We need to understand. So last time we will discuss about that if there is a case where the person having lots of symptoms, dangerous symptoms, and we have few remedies. We can use this remedy to antidote, because in boric materia medica, behind, if we see the relations of the remedy, there are lots of remedy which are showing in the antidotes: complementary, follow it, not follow, and antidotes. So we should know the antidote, and if he provide which kind of medicine he is taken, and after that he get these symptoms, we can get the rough idea. So what we have to do in this case. So thus, tracing out the complete picture of the disease, he will be unable to combat it with a suitable homeopathic remedy, so that the patient shall not fall a sacrifice to the injurious drug he has swallowed. So we have two scenarios now. One where we can wait and we can leave the patient for a few days, and we can try to antidote the effects of homeopathic remedy. It will give us a pure picture. Second situation, we don't have a time. We have to prescribe the medicines. So we have to take the patient collectively. If we can get the idea what kind of medicine that person already taken, we will try to antidote, or we have to prescribe the remedy so the patient can get relief without sacrifices conditions. So these are two things which is important while active role of the physician. Fourth things, this is the patient disposition. We already know that the disposition is explained in aphorism number 210, 211, 12, 13, where disposition is described. But in aphorism number 96, many times the patient behave is more than the patient's problem. Beside this, the patient themselves differ so much in their disposition that some, especially the so-called hypochondriacs. So here the word hypochondriac is need to understand, because if we know the hypochondriac patients, then we can easily understand how we can judge these patients. Hypochondriasis. So hypochondriasis is a person who has an excessive preoccupations with the belief that they are suffering from any serious kind of disease. A person who feel that if I have a pimple here, he believes that this will become a cancer. It will be a cancer, and he will visit lots of laboratories, lots of testing, lots of doctors, one by one. He will try to get information from the doctor, and doctor says, "Oh, this is small pimples. You don't need to worry." But doctor, go for investigation. I think something happened here. He's not able to resolve by itself. This is a type of disposition where the patient explain their problem. And the key feature of this hypochondriasis is number one, constant worry about health. The first very important part, which is the key point, how we can understand that person is the hypochondriac nature. First, constant worry about health. Second, repeated medical consultations. Repeated. One by one, he visit 10, 20 doctors. And I have that patient. If he sneezes more than once in a day, he will call different doctor. Oh, doctor, I have a two sneezing, and I give me investigation. I will go for the investigation. I don't know why this happened to me. This behavior, this is definitely a hypochondriasis. Then distrust in medical assurance, reassurance. If you says, oh, no problem, this is not a big problem, this has happened many times, no, he will not believe on you. Fourth, excessive body monitoring. If he will go stool 2 times or 3 times a day, if he eat slightly more than its daily routine, and he get fullness in the abdomen, this now the problem started. Why this happened to me? I think my liver is involved. This is because of my liver. I have this problem. And he didn't feel that he eat more than enough. Then emotional distress. Then avoidance and obsession. Obsession here. So hypochondriasis. How to deal with this hypochondriasis? Dr. Hahnemann mentioned in 96 that patients themselves differ so much in their disposition that some, especially so-called hypochondriasis, and other person of a great sensitiveness and impatience of suffering portray their symptoms in two vivid colors, different colors. They once they are in zero state and suddenly they are reached to the peak. Doctor, I have heard that if the throat infection is recurrent, it will convert into cancer. Go for investigation. Do some give some medicine. I can get the relief as soon as possible. So they are always in the peak. So vivid color, different shades, different explanations, different theories. Because some people read lots of medical books like Kilkeria Carr. I have one patient suffering from cancer. And when I see that patient's weight was 45. And after taking the case, I prescribe a medicine. Within 3 months, his weight now is 62. Improvement, lots of improvement. And what he believe, he read lots of medical books, lots of medical literature, lots of other pathies other than allopathy. He don't like allopathy because he feel that allopathy will worsen the condition. If I take the allopathy, I will die within a few days. They will read lots of medical literature, even though they are not from medical field. Like they read regularly Ayurvedic books, regularly Unani books, regularly homeopathic books to find out which symptom is matched with them, and they imaginary match their symptom with the other books and start taking medicine. So different shades. And in order to induce the physician to give him relief describe their ailment in exaggerated expression. Exaggerated expression. This is the word which we need to understand. So he eat more than enough, and after eating more than enough, he has a abdominal pain. And he will visit lots of doctor. First he start taking home remedies. I can take this, I can take that, I can use this one. Hey, give me this one. If he will not get the answer, he will not get the relief, then he will go out. Call the doctors. I have this problem, that problem. I'm not able to breathe. Doctor, I'm not able to breathe. I'm not able to lie down. I am not able to sleep. And everything is attached with little extra food. And they will reach to the peak. And they explain their symptom that they are suffering with a very serious condition, and you should notice, and you have to give me a medicine as soon as possible. This is exaggerated, very, very excessive, very, very we can this as intensify their symptoms. They are intensify their symptoms so that the physician feel that, oh, that patient is very serious, we have to give them medicine as soon as possible. But if you guys give them only a Saclac placebo, and after a while he will say, oh doctor, now I feel better, it means the condition was not the actual form. The condition was not that much serious, but he expressed you like this is very serious condition. Now, the importance of footnote of this aphorism, 96 aphorism footnote. A pure fabrications of the symptoms and suffering will never be met with in hypochondriasis, even in the most impatience of them. If you feel that you will get the pure symptoms in this patient, never. Because they intensify their conditions. The situation is not that much serious as they are showing you. Then, a comparison of the suffering they complain of at various times when the physician gave them nothing at all. Patients come, you give hey, sit, I will give you a medicine, give the placebo. And after 5 minutes, say, oh, doctor, now feel better. And you will realize that person have nothing that much serious. Now he is feel okay. So it give you a rough idea that person is not having a actual trouble. A comparison of the suffering they complain of at various times when the physician gave them nothing at all or something quite unmedicinal prove this plainly. It will prove you that that person was not that much serious. And if they come and sit and give the placebo, definitely you will get the answer. But we must deduct something from their exaggerations. We have to take the case, but in low quality. And at all event, ascribe the strong character of their expressions to their excessive sensibility, in which case this very exaggerations of their expression when taking of the ailment become of itself an important symptoms in the list of the feature of which the portrait of disease is composed. The way the patient described you, the way the patient's explaining their symptom, how fast after suffering the patient comes to you, how the patient is explaining their characteristics, this is itself a key symptoms of the remedies. So we have to understand the way hypochondriasis is a typical form of personality disposition, but if the hypochondriasis patient, the way they explain their symptom is much more important here. How, what type of peak they reach after during explaining their symptoms. This is itself a very, very important symptoms. So the case is different with if the person is insane and if the patient is rascally feigning of disease. Feigning means person lies to you, I have the problem. Feigning sick, he doesn't have any problem, but he just lying. I have because so many times, like the person having a very a meeting in the office and he just not want to attend that meeting, and he will feigning sick. I have abdominal pain, I have a chest pain, I'm not able to walk, I have a body pain, these symptoms. Even small kids, they feigning sick. If they don't want to go to school, oh, I have abdominal pain, I don't want to go to school, I have a throat pain, because these in these conditions you are not able to judge. You don't have any tool to find out the quality of pain, and this is a sensation which only described by the patient. So this is one character. Other characteristic is when the patient is absolutely opposite character. And what is that opposite character? When the patient is indolent. Aphorism number 97. Other individual often opposite characters, however, partially from indolence, partially from false modesty. False modesty. It means they, because of the false modesty, they don't like to explain. Partially from a kind of mildness of the disposition or weakness of the mind, refrain from mentioning a number of their symptoms. Refrain means they hold up. They hold up these symptoms. They will not tell you these symptoms because of they are lazy. Because if somebody know about this, oh, this person having these symptoms, what they think about me? So leave it. They will not tell you. Then mildness of the disposition. When they are mild, they are afraid. They are not able to explain their internal feeling. And sometimes they are the weakness of the mind. Weakness of the mind. They forgot to mention these conditions, mention the symptoms. So they will not give symptoms. And describe them in a vague terms. Vague term means lack of clear or precise manner. There is no clarity of these symptoms. They describe you, but not in clear form. Then allege some of them to be of no consequences. So sometimes they describe, doctor, oh, leave it. There is no importance of these symptoms. So leave these symptoms. Oh, so I'm not able to tell you. And they will leave symptoms because they feel that these symptoms have no importance. Or sometimes that they don't know that they have these symptoms. Doctor, how I can explain? Even I don't know how what happened to me. And one very beautiful book which give a very good explanation, that are the lectures of Denham. This book. In this book, Dr. Denham gave lots of different ideas how to deal with these patients, how we can understand patient more clearly. I give you few examples, and whenever we get time, we will go through. This is Lectures on Materia Medica by Coral Denham. Coral Denham. So there are lots of places where Dr. Denham described few important things. For example, we have a case of skin disease. He mentioned Dr. If I have uh, if I have a book, so you guys can read easily. Okay. Wait, I will share my screen so everyone can see. So you guys can see my screen?
Yes.
Yeah. So in skin diseases, wherever we meet the well-defined smooth erysipelas of belladonna, or the vascular erysipelas of rust, or the bulla of the euphorbium, tracts of graphitis, or the lichens of clematis, or the impetigo of lycopodium, or the hard scabbed ulcer of mesarium, from the edge of which thick pus exude uh, on pressures. Do not these symptoms almost determine our selections of the remedy? So if we read, these symptoms are only valuable if during proving these symptoms are developed. If these remedy produce these kind of situation, then these symptoms are important, and it will give us a key indication of the remedy. So, the white tongue of the pulsatilla. White tongue of pulsatilla. Red trip, dry tongue of rust. The moist trembling tongue of phosphoric acid. The broad tail, puffed and tooth intended tongue of mercurius. The yellow coat at the base of the tongue of Mercurius prutoides, or the patchy tongue of Taraxacum. Do we not recognize this symptom as most important indications for these remedies respectively? Definitely. Because
So
I have one case, and that lady having a liver problem, and she has a mapped tongue, but the quality of that tongue was very important. The whole tongue is moist, and she has a very, very excessive thirst. Very, very excessive. If we think of, if we remember the aphorism number 153, peculiar, characteristic, uncommon symptoms, and where you will find out that the person having a moist tongue and excessive thirst with geographic tongue. This is the keynote of Merksol. And that Merksol, within a 15 days, all the symptoms of their liver complaints are reduced to minimum level. So these are the indications, these are the key factors which are important. Not always, if we are sometimes we are following and looking for the mind symptoms. No. That's why proving is much more important here. Understanding of proving is more important here, because Hahnemann proved the medicine and he know that what kind of medicinal substance produce what kind of symptoms on the skin. What are the doctrine of nature? What are the doctrine of that remedy? As if anyone attend our Allen's keynote, where I describe about Artemisia abrotinum, if that is taken in the crude form, if they use that crude drugs on the skin, it will cause absorptions of the water from that skin, and the texture of the skin become wrinkled, waxy. These kind of condition produced by Artemisia abrotinum, especially in the crude tongue, and it causes emaciation by absorbing the water. And this is the characteristic of abrotinum, and you will find that mostly abrotinum having a emaciation starting from the tongue and go upward. Then, shall I further mention the objective symptoms? These are objective symptoms. We have to see and we have to judge that it is important or not important. If we can take it as a characteristic symptom or not. And for example, sandy grain deposit in the urine, red deposit which adhere to the vessels, or various peculiarities of feculent excretions and the sputa, which are well known and universally admitted indications of certain remedy, and in their radical pills and the heart rhythm. Heart rhythm. Then next important is this one. Further examination reveal other objective symptoms for others as well as for subjective symptoms. We must depend on the testimony of the patient and his attendant. Objective symptoms are important if the person know the importance of characteristics of remedy and the patient having this trouble. If we know what medicine produce what kind of objective symptoms, like plethora, facial plethora, false plethora, these are subjective symptoms and we can see them clearly if we know that. So we have then to listen to testimony and initiate more testimony by questioning and cross-questioning the patients and his friends and form conclusions from their evidence. So we have to understand, we have to take characteristic after cautioning to the patients and their relatives, and we have to cross cautioning that person what he's saying is true or not, and we have to wait evidence. And here we encounter that task which is similar to that of like a lawyer examination the witness. So we must study our witness and the patient as he of a sound understanding first. When we are talking, when the person is explaining their symptom, we have to judge that what we are asking, is it that person who give us a exact clear answer? Is he has a sound sense? He has a sound understanding. This you can judge just after taking a conversation. Then may we depend on his answer being true or rational? Can we believe on that person? Can we believe what he is saying is true? He may be naturally stupid or idiotic. He may be insane. He may be delirious under the effects of the present condition or present illness. If the patient's one person having a fever, if you guys have a Allen's keynote, just open it. I just gave you one wonderful example. Open Podophyllum. And see in fever paroxysm. In fever paroxysm at 7 a.m. with great liquidity during chill and heat. Doctor, whenever he has a fever, whenever he feel cold, and if we touch that person having a fever, that time he is non-stoppable talking. Continuously talking. And we tell them, stop it, take rest. But he is not stopping at all. He's just talking, and talking. Very characteristic. Rare uncommon symptom of the patient, and the podophyllum is the case. Continuously talking. Great loquacity. During fever, when the body is hot, the patient feels chill. But whenever he has a perspiration, he sleep. Very characteristic. Peculiar. Then, or putting out of view these extreme positions, is the patient disposed to aid us by communicating freely his observation on himself, or is he inclined to reticent? One side, the person know his feeling, know his sensation, and explain, oh doctor, I have this problem, I have this problem. Whenever when I go on the outside, the air was very cold, and within a few seconds I feel that that person I have start problem, and I feel that I will be sick in the evening. And that time the problem start from the tip of the nose. I feel that my nose was very, very cold. And after a while, and the nose running started, and lots of sneezing. And during this sneezing, I have a abdominal pain. Whenever I sneeze, I feel the pain in the abdomen. In this way, the patient explained every detail. But on the other hand, is he inclined to be reticent? What is reticent? Very few words. What happened, doctor? I have a nose running. Okay. When it start, I don't know when it start, but still I have a nose running. I'm not able to breathe. Okay, I know that no, you are not able to breathe. What kind of symptoms you had when he start? Where you go before when he started? He will not give you exact answer. He will not give you the answer what you want. Few symptoms. So you will be surprised at the difference in the patients in this regard. This is the judgment what homeopaths do. Homeopaths do while the person is sitting in front of us. So we have, if we know that these conditions or that condition, this nature of the disease and that nature of the disease, this disposition patient and that disposition patient, how they react, how they explain, this is very important. Some meet you very frankly. Oh, doctor, how are you? I see you there. You was in park. Oh, after that, I feel that I have to go there, doctor. I have to meet them. Now I'm sick, doctor. Oh my goodness. This is the time when I have to meet you. How are you? How are your family? Like this. Very frankly. Conscious that by replying fully, if you ask question, they give you a full answer. And by standing their case very carefully, and they are adding you to help them. Feel that if I explain my symptoms, if I explain everything to doctor helped me. But other act as if they felt that in meeting the doctor, they have come to an encounter of wit, like a competition, knowledge competition, and in which they determine that their cunning shall baffle this his shadow. So others again are morbidly desirous to make themselves out very sick. They are not that much sick. They are behaving like that. They are very sick and will unconsciously consciously wrap their statement of their symptom as, so as to justify their preconceived notions of their sickness. I think, doctor, I have something in my, I have a continuous headache, and I know that if something inside, if some tumor inside, if something happened inside, then this type of headache was there. And I don't know, doctor, Gus, you are here and you have to ask me the questions. Then you have to go for investigation, whatever you need to go through it. But I feel that this kind of situation is happened in this kind of advanced pathology. And few patients says, oh, say, what happened to you? You are the doctor? Ask. This is, you are a physician, you know the body, you can ask whatever you want. Tell me about yourself, what I tell you. They behave like this. Sometimes what you ask, patient is not able to understand what he has to give answer, what kind of answer you want. The coordination difficult is the rubric and repertory where the patient is not understanding what the physician need from them. So if you question them, however, you may frame your questions. They will reply as they think will make out the case you seem to apprehend. Others, on the contrary, so dread to give testimony which they fear may make it certain that they have some apprehended disease and they cannot bring themselves to state facts as they are, but twist and misstate them as they fain would have them. So, like in aphorism number 97, they will not give us a correct answer because maybe they are indolent, maybe false modesty, and maybe a kind of mildness of the character, and maybe they have a weak mind. They will not give us a exact answer. They not give us a exact answer. So this is important book and everyone should go through this literature. Then one very important uh, aphorism where Dr. Hahnemann describe about females whenever we are dealing with females. If you can open your cameras. Aphorism number 94. Very, very important. While we are taking history of the patients. History starts from aphorism number 5, where Dr. Hahnemann described about importance of the history. If we read aphorism number 5, unless to the physician is assisting him to cure or the particular of the patient probable exciting cause of the chronic acute diseases, and also most significant point to the whole history of the chronic disease to enable him to discover fundamental causes, which is generally due to the chronic miasms. And you to understand that point of history, we have to judge his moral and intellectual character. We have to understand what kind of occupations that has, what kind of mode of living and habits, what are the social and the domestic relations, what kind of age, sexual functions. And if you see aphorism number 94, you will see while inquiring into the state of the chronic disease, you are dealing with the chronic disease and the particular circumstances, very particular circumstances of the patient with regard to his ordinary occupations. What kind of work he is doing? Is he has a night shift? He's not able to sleep. And whenever he come back to the house, he has a kid. He has to take care of the kids, and she or he is not able to sleep properly. Occupation, it will give us an idea why that person becomes sick. And if you read Cocculus Indicus, where the loss of sleep is the biggest reason of their sickness. Loss of sleep. There are lots of students who didn't sleep because of the examinations. Loss of sleep. Reason. His ordinary occupations. Then his usual mode of living and diet. What that person is eating. For example, there are lots of person who's driving the transportation, truck drivers, bus driver, and while driving, they eat from outside, junk food, lots of junk food, lots of food which having a excessive fat, and they have abdominal complaints started. Diet, his domestic situation. If we understand the domestic situation of anyone, everyone, at home, at school, at work, outside, inside, in relation, husband, wife, and parents and children's in between children's, brother and sister, brothers and brothers, what kind of situations they are facing, then we can understand. So forth must be well considered and scrutinized, and to ascertain what there is in them that they tend to produce and maintain the days. What kind of things are there in these situations, domestic, maybe occupation, living, diet, domestic situation, what is in it which maintain the disease? And in order that by their removal, the recovery may be produced. 94. And if you see aphorism number 208, while case taking, the age of the patient, because few things comes with the age, mode of living, diet, his occupation, domestic position. Why Hahnemann give more importance to these things? Because maximum times, if the person is coming with the chronic disease, the reason you will find in these situations. In aphorism number 5, Dr. Hahnemann saying the same thing. In aphorism number 94, he gave the same thing. And in aphorism number 208, he again repeat the same thing. Because these are very, very important if you are dealing with chronic disease. His mode of living, diet, his occupation, his domestic position, and social relations, and so far must next to be taken into consideration. We have to consider, we have to go through all these situations. And in order to ascertain whether these things have tend to increase his malady, if these things can produce and can these things can maintain his disease, and or in how far they may favor or hinder the treatment. And like manner, the state of his disposition and the mind must be attended to, and to learn whether that present may obstacle to the treatment or require to be directed, encouraged, or modified. Is it helpful, or we have to modify, we have to motivate that person? No, no, this happened to everywhere. You have to maintain yourself. It may be the person is distressed from their family reason, domestic situation. We have to boost the person. Sometimes the words give motivations to the patient, and they can get these things can help us. Then, if we are dealing with female cases, aphorism number 94, footnote. Aphorism number 94, footnote. In chronic diseases of females, it is especially necessary to pay attention to the pregnancy, sterility, sexual desires, accouchements, miscarriages, suckling, and the state of menstrual discharges. Focus on it. With respect to the last name, more particularly, it means the state of menstrual discharges is very, very important in female cases. And we should not neglect to ascertain if it reoccur at too short intervals or delay beyond the proper times, and how many days it lasts, whether its flow is continuous or interrupted or intermittent. Come, started. Come, started. Stop, started. Intermittent. And what is its general quantity? How dark is its color? Whether there is leukorrhea before its appearance or after its terminations, but especially by what bodily or mental ailment. It means we have to use this bodily and mental ailment like a concomitant symptoms. Concomitant symptoms. And but especially bodily and mental ailment, what sensations and pains, what is its nature, what sensation attend his flow, or what quantity it is, and what are the condition and the occasion under which it occur. Every word you have to read again and again and again and again, so you can remember while taking the case. Especially females. Especially females. Then we discuss aphorism number 93, 94, 91, 92. They are interconnected. Every aphorism is interconnected with practical homeopathy. When we sit on the seat, we should remember organon in our brain so we can have less error. We can do error because this is a human nature, but if you remember organon, you will definitely have less errors. So this is the active role of physician while case taking. Then we have different type of diseases: acute diseases, chronic diseases, and one more important, I just forget to mention here about the females. Open aphorism number 284 footnote. Especially the in sixth edition, Dr. Hahnemann add one very peculiar, very important footnote. The power of medicines acting upon the infant through the milk of the mother or wet nursing is wonderfully helped. If a small baby suffer from any kind of suffering and the parents don't want to give a medicines, you can prescribe that same medicine to the mother, and it definitely helps small kids. So the power of medicine acting on the infant through the milk of the mother or wet nursing is wonderfully helpful. Every disease in a child yield to the rightly chosen homeopathic medicine given in moderate dose to the nursing mother. If we prescribe that same remedy to the mother, it definitely help nursing mother, and so administered so is more easily and certainly utilized by these new world citizen than is possible in the latter years, since most infants usually have imported to them sora through the milk of the nurse, and if they do not already possesses it through hereditary from the mother, they may be at the same time protected antisorically by means of the milk of the nurse rendered medicinally in this manner. But the case of mother in their first pregnancy by means of mild antisoric remedy. So if the lady is pregnant and you know them very well, you can prescribe antisoric remedy from the first day of pregnancy. So we can eradicate sora, especially with the sulfur dynamization prepared according to the directions of this edition, for the sixth editions, and indispensable in order to destroy the sora. That producer of most chronic diseases, which is given them hereditary, destroy it both within themselves and in the fetus, thereby protecting posterity of in advance. And this is the true of pregnant women thus treated. They have given birth to children usually more healthy and more stronger, and to astonishment of the to everybody, a new confirmations of the great truth of sora theory discovered by me. So that's why if the lady is pregnant and she is under your treatment, antisoric treatment will give us a healthy and wealthy child. Especially females. So aphorism number 94 and footnote of aphorism number 284. Read it again and again while dealing with female patients. While dealing with female patients. So this is all about today's. So next we have a different categories: acute diseases, chronic diseases, epidemic diseases, sporadic diseases. We will discuss about that thing. And now if you have any questions, just open your cameras. Let you ask any questions you have now. Any questions? Anyone, any questions? So go through whatever the aphorism I mentioned. Go through that aphorism so you can more easily understand. Dr. Sessions, you have any advice for us? Your voice, you are just unmute. Just unmute yourself. Yeah.
Okay, yeah, I had to leave for like the middle segment, but the observation, and I like the way that you brought up Carol Dunham. Everybody should go to archive or whatever, like the Indian book thing, that website, and read his book. That is very, very helpful. Also, his therapeutics is very good. And in regard to female symptoms, they are so, so, so important. I remember a long, long time ago, before I really, really delved into Organon and the chronic diseases, I remember, people would just be like, you'll ask them about their period and they'll say, it's normal. But that's not true. What's normal for them isn't necessarily what's normal therapeutically. So if somebody has a woman has a period that lasts for 6, 7 days, that's normal for her, and she doesn't think of it as being a problem. And so, but when we get a hold of that information, that's very important to us. Or, for example, the dates, when the menstruation starts and when it finishes, that length of the cycle is also a very, very, very important indicator that can really be like an elimination rubric or something that that really gives such important information in the case. If somebody's menstrual cycle is 43 days, which, this happens, then we are getting rid of we're discarding all the remedies that have short cycles. And it's just really, really narrowing down our case. And it is really, really important information. I think that I did a webinar, a learning session about that maybe 4 years ago. It was really, it's so, so important, so, so helpful to look at all the different things pertaining to the female and her functions. So do keep that in mind. And just like the vendor said, you want to keep all this information. You can even just have like little check off sheet for yourself when you're seeing somebody, just to make sure that you're kind of getting it all. But thank you very much for all these great reminders.
Thank you. So we have one more personality here, Dr. Kudrit Parper. Can you, ma'am, please open your camera? She wrote a book on case taking. Absolutely. I just want to uh, invite you. Can please tell me about yourself and about your book?
Okay, thank you. I'm a medical doctor from Turkey, and we have been doing workshops with Joseph Kellerstein, the Canadian homeopath, and I loved the way of his teaching homeopathy. And then I want to buy one of his book. He said, I didn't write a book. I didn't have any time to write a book, and I said, okay, I have time right now. Can I convert our workshops into a book? He said, absolutely. And then I converted into a book. So this book is about about case taking and management. It is for people who already knows homeopathy, the basic homeopathy, the first chapter is how to question a case, a patient, the questioning techniques. He used NLP and the clear language technique for that. So he's mostly talking about how we can interpret what the patient says. And the second chapter is about analyzing and finding the uh, correct remedy. And the third chapter is mostly about managing the case. What is what can we do after the remedy? This symptom came now. Do we antidote it or do we complement it? How do we manage in the long term the case? It's it is like this, and I moved United States 5 years ago, and I have been dealing with homeopathy for 15 years now. And I have been teaching homeopathy as well in London College of Homeopathy, but last year we separated our ways, and I next year I will start my own teachings in Turkey.
Well, if you teach in English, then we are going to invite you here. Gives one session on case taking or any chapter you want to discuss next week or any times whenever you have a time, so we
Uh,
can get more informations about it, because I'm reading all the authors which
uh,
are present during Hahnemann time. That's why we are working on Hahnemann only here. So what Hahnemann write it down, what other person or the other personality understand Hahnemann, how they use that data to get the patients cured,
Oh, like
not
Bonninghausen.
just not just managing, cure them. If we read that data, if Dr. Disdale, Dr. So many doctors are there, Dr. Graffit Rao, and uh, there are lots of doctors that time, how they understand Dr. Bonninghausen, how he understand Hahnemann. It means what we get, we have to describe as it is. But every physician have different experience. Your experience different from us. Dr. Session experience is different from other persons. So we invite you whenever you have a time. We have
okay, thank
a
you.
small community, so we can listen to you, how you understand, and we can learn from your experience too.
So in this book, we there are 30 cases.
Okay.
What Kellerstein does is like he took a case from literature from Heinemann time. For example, we have Barrington's case, we have Burke's case, we have lots of case, Erastus case here in this. He was doing like this, the workshops. He was taking a case from literature and go level by level how, for example, Burke reached that remedy from that case, and we do our own analysis on that case, and that is how he teaches the homeopathy. That's why I loved it, with the facts and with the references and with the practical part of it. And we have cases in this book with the literature and with Dr. Kellerstein eyes how that case is solved. Unfortunately, he cannot lecture anymore. He's so sick. But I would love to make a class like him. Next week, I'm sorry, not month. Next week, I'm going to Turkey for a vacation. I'll stay like 7 weeks to there, and I'll be back in September. I can do something after September.
Okay, no problem, no problem. Because we are here to learn from each other.
Yep.
So I am discussing because I am reading Alan Hanneman, and I already translate his whole work, whatever he did, and I translated into my native language, Hindi, and very soon I will publish it. But I just want to show people that if you did not read Hanneman yet, definitely you guys miss lots of information. Lots of information. You miss a lot because
So much.
whatever we have today, it's because of Hanneman. It's because of Hanneman. Every person who understands Hanneman, definitely you will get more clear, more broad idea about him. So we are here to learn from each other, and every experience which help us in our practice is welcoming here. So this is only motive here, and we definitely